I'm Dr. Kim Dennis. I'm a board-certified psychiatrist, eating disorders and addiction specialist, and we are at SunCloud Health in Highland Park, which is an outpatient clinic focusing on helping people with complex co-occurring disorders and trauma heal in a sustainable, lifelong way. And I'm the co-founder and medical director of SunCloud. I'd spent about a decade working at a residential that's about an hour away from here. And that place had grown and grown and grown and grown. And the work that, because of what's going on with healthcare, because of parity, because of insurance limitations, a lot of times people nowadays aren't able to sometimes even get residential care, but when they do, a lot of times it's shortened. It's 3 weeks, maybe 4 weeks, whereas in the past we were able to work with people for months and really get to some of the underlying traumas and underlying issues that cause problems like addiction or eating disorders or suicidal thoughts. So I was really invested and interested in treating people more longitudinally, developing healing relationships with people that last for much longer than 3 weeks or a month. One of the other problems that I was finding in that setting is that people would come, fly into Illinois, get treatment, and do okay, but then they'd go back home to limited treatment or no treatment and just fall right back to where they had been. So for some of those are some of the reasons why David and I wanted to start SunCloud, to provide truly integrated treatment and to provide it over the course of a person's life, rather than episodic fragmented treatment, so people could actually continue to grow in their recovery and maintain their recovery for years and years and years with support. Just like if somebody has coronary artery disease or diabetes, they continue to see their primary care doctor or their endocrinologist or their cardiologist, even if they're doing well, to maintain their health.
Right.
I think people who want to get well want that to be a sustainable thing for them. I don't think people are really interested in being well in a supported, structured setting and then going home and being unwell. So I think sustainability is part of what draws people to SunCloud. Sustainable recovery and finding a way of living that is not only not in disease, but abundant and thriving. The capacity to have a long-standing relationship with a doctor or with a treatment provider, I think, is really important to healing some of the underlying issues. Almost every patient I've ever treated with an addiction or an eating disorder has some way, shape, or form of underlying adverse life experience or traumatic experience. And there's a whole different range of what I mean by trauma. And many of these people either haven't had treatment that understands trauma and can help people heal from the underlying trauma, for instance, that only focuses on the addiction or only focuses on the eating disorder, but isn't focused on both the addiction and the eating disorder and the underlying trauma. So I think that's another aspect of what we do here at SunCloud that's really unique, and that people can't find at a lot of other places. It is an ambitious goal that we set, and these are complex patients that have usually not done well at a lot of other places. And part of the other, I guess, impetus to create this place for me personally was to be able to work with people that I really believed in, staff that I really believed in, and handpick those staff. And that's something we have here in our smaller, more intimate setting. There's just nothing better for me professionally than helping women and men who feel really, really different, really, really isolated, really, really hopeless, start to believe that they can recover and they can have a meaningful life. And when you're able to get to the underlying traumas and the truth, the truth of the person's experience, life experience from the ages of 0 till now, people start opening up and believing in ways that they maybe haven't in the past. And they start to heal, and they start to live good, happy lives and believe that they deserve that, just like everybody else. One of the things that's important for me to get across to anybody out there who's struggling alone in isolation, feeling enslaved to addiction, to eating disorder, to PTSD, to depression, self-injury, suicidal thoughts, is that you don't have to live that way anymore, that there is help. The bad news is that these are terrible diseases that wreck people's lives and sometimes kill them. And the good news is that there are treatments available to help you, and places where you can go, like SunCloud, that are going to be able to help you recover from all of the different facets of whatever is plaguing you. There's still hope, and that we can help.